Hi there, how are you today? I'm your student nurse, Sarah. I'm going to be doing your wound assessment and setting up a sterile field. Can I just please get your name and date of birth, and are you okay with me touching you in general? Okay, perfect. I'm going to, do you need to use the bathroom, or are you in any pain or discomfort? No? Okay, I'm going to give you some privacy and come on in. And I'm just going to adjust your, well, I can't think, adjust your bed to a workable height. Thank you. And since your wound is on your abdomen and like the way that it's set up, I'm gonna pretend this is like a blanket cover and just cover like that. And are you having any pain or discomfort? Are you feeling okay? Okay. And so I did hand hygiene, and now I'm going to put on gloves. And I'm gonna start assessing your wound. So, I'm going to feel your wound back gently. And this, we'll just say this is the garbage. And can you see me okay?
Mm-hmm.
Okay. Okay, and as for your wound, I am going to take a look at assess your Rita. So your redness, it doesn't look like you have much redness, like mildly at all. Your approximation is about 1 centimeter. It looks like it's healing nice. There is no fluid, there's minor swelling and no discharge, and no maybe minor bruising in the middle, but it doesn't look like much, like nothing I'd be concerned about. Yeah, so that's everything for your assessment of your wound. And now I'm going to take off my gloves and I'm going to perform hand hygiene again. And I'm just gonna put this here like pretend it's a garbage, blah, 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 whatever. And now what I'm going to do is wipe the table down. Okay, I can't get it out, so wipe the table. And now I'm going to be setting up a sterile field, like for someone to come and take care of your wound. Okay. So we have your gauze there, a measuring thing that we already did, and also on your wound there's no tunneling, there's no like depth to it. Okay, and for this, there's a little spot on it usually, and so I'm gonna open this, and this table is clean, everything is clean. So garbage, and I'm going to take within 2.5 centimeters. So the entire border is where you can grab before, like everything else is sterile inside. So I'm going to grab like that without letting anything hang over. Oh, sorry. Still grabbing the borders on both sides without letting anything hang over the towards me on this side. So there we go. Still within borders. And then I'm going to grab the little tweezers, I forget what they're called, and the sterile is the top, like where the little like pinchy things are, the top is the sterile, and below that is like the not sterile field. And so I'm going to pull this out, and before I adjust it, it might hang over a bit, but we go like this and adjust it so it's a square, and grab like that, and then oh god, I know what I did wrong there. That's okay. And then now I'm going to take this out and put this not on the border, like keeping everything sterile still. I'm going to be moving these tweezers, the other tweezers, in here. And now I'm going to open an extra pack of gauze. So keeping the sterile part on the inside and the unsterile part on the side where it's not sterile, like the border. And for the gauze, you open it not over, you open it here, keeping within the borders of the thing, and then you go over once you open it, and you gently let it fall, and then you dispose of this. So at this point, I am going to put the solution. So what I do with the solution is I open the cap, I put the cap outside of the sterile field, and then I pour it so the label is outward so the liquid doesn't get on the label, and I pour it inside. I'm just going to pretend pour it, and yeah, and then I put it back on, put it away, and then, sorry, I'm just thinking. And then now I'm going to move some stuff to the side, just like give me grace. And now I'm going to put on my sterile gloves. And what I'm going to do for that is open these. And maybe I'll perform hand hygiene just because, but I don't think you need it since I already performed hand hygiene. Everything was sterile, but just in case, I'm going to do it again. And I'm going to remove this, and there might not be enough like room for the video, but this is all like in its own space. So everything here on the outside is like what I'm allowed to touch. So you go like this, and you gently fold it, and then you go like this, gently fold it, and then this, take these folds out, and you're gently folding this. And you're trying to not like shake everything and like make it unsterile, and you're just grabbing within the border here. So then for my dominant hand, which is my right hand, you're gonna take your other hand, grab the inside of this glove for that hand, and you're going to go like that and slide it carefully as you can, and without touching the part of the glove that will be going outside, like that. And then with your two fingers, you're gonna go in here for your other glove. Sorry, this is moving a bit. And, okay, my brain. Go like that, and then slip your other hand in while maintaining sterile field, only touching your hand within the cuff. Then gently pulling over while maintaining the clean parts, like on the clean parts of the glove, like that, where everything's clean. And then you go like this to ensure it's fitted properly, and then it's sterile. And that's it.